All right. So we're here today with Nancy. Nancy's been a patient in our office for, it's been about 5 months now. And I've been meaning to get this sooner, I just haven't gotten around to it. Nancy came in, her major health concerns were she was diabetic, she was taking insulin and oral medication as well. She had high blood pressure, high cholesterol, high liver enzymes, and she just wasn't feeling as well as she could have been. So 5 months out, tell us a little bit about what your experience is and what's happened since then.
Well, I've started to change my diet and gotten off of gluten and dairy products and began to lose some weight. Not the amount that I wanted, but I'm working on it still. And gradually my blood sugar started dropping, and it dropped more and more, and to the point where I got totally off of insulin, which was a big accomplishment for me. I was taking 4 shots a day.
And you know what? That wasn't that long into treatment either.
No, it was
less. It was like a month.
Yeah, 4 or 5 weeks exactly.
Yeah. Okay, we're still taking the oral medicine, but the insulin you've been off of for quite some time.
Yes.
Okay, great. Go on.
The other thing was I've had issues with my liver for a number of years, where my liver enzymes have been very elevated, and cholesterol's been elevated, and high blood pressure, and my blood pressure's just dropped like 50-60 points. It's now down in a normal range, a good normal range. My liver enzymes dropped tremendously from way high to normal ranges, which I haven't seen ever.
Great.
And what was the other one? My blood pressure,
cholesterol, liver enzymes,
and the blood pressure's come down.
Right.
I'm off of blood pressure medicine.
Great. So, fantastic.
All of that's, yes, it's amazing. All of that's much better.
So the interesting thing is with liver enzymes that are high, I see this relatively frequently where patients come in with liver enzymes that are high. They're not high enough that they would be pathologic, like hepatitis or something like that, but they're double, triple, quadruple what they should be, but under 100. And what I see without fail is those patients are normally undiagnosed celiac patients. So as you know, we checked you like we do all of our patients, and we had some of those issues that came up for you. So really the driving force behind those high liver enzymes for you was the fact that you had a problem with wheat products.
Right.
And when we took them away from you and did some liver therapy with you, that cleaned up really nicely. I was surprised myself to see the numbers right themselves so quick. Right. What would you tell other folks who have a similar problem, diabetic, maybe prediabetes, syndrome X, high cholesterol? What would you tell them about what you've experienced here, and what would you recommend as far as what they would do?
Well, for me, I was tired of taking insulin, and I knew I needed to change the way I eat. I didn't know it was gluten, but I knew I needed to get off of eating so many sweets and sugars and carbs. And I just couldn't seem to get a handle on it, and that's what you really helped me with. And we really wouldn't have known. You knew it, but I wouldn't have known it without the testing. And so I would recommend anybody that wants to get off of insulin that there are other ways to go get yourself checked out, see if there's other issues going on, and explore those options.
Yes, I wanted to recap on some of the numbers with you too while I'm thinking about it. Nancy's A1C initially was 10.6.
Yes.
And we redid blood work at like I think it was
about 3 months.
A 3-month interval, and it went to 6.5.
6.5.
Which is right outside the lab range. Right. The lab range for diabetes is above 6.4. So technically, according to the lab, you still have diabetes because of the numbers. Also, your actual fasting blood glucose was where in the beginning? Your blood sugar when you took it?
The fasting blood sugar, it was still high. I don't remember exactly what it was.
On your initial blood work, it was 178, I think.
I knew it was
and
high.
Then it dropped to like a 135. So we still have some work to do, but I'm really pretty pleased with the results we've had thus far.
And I was very surprised to see this much difference in this short
period of time. You're right. Yeah. So we still have some work to do. We'll check back with you in a few months once we get a few more things done. All right?
All right.
Thank you, Nancy.
You're welcome.
All right, so we're here today with Deborah. Deborah is a patient of ours. It's been about 3 or 4 months, probably been 2 or 3 months actually now. Hasn't been that long. When did we start?
It was the end of May, wasn't it?
End of May.
Latter
That sounds.
part of May.
Yep, that sounds about right. Her chief complaint when she came in was that she was having a hard time regulating her diabetes. She was taking a good amount of insulin every day, and she was still running on the high side. She also had some digestive problems, a lot of burning in the stomach and bloating and some other things. So tell us a little bit about what brought you in, what the problems were that you were having, and what you've seen so far as the results with our protocol.
Okay, well, when I first came in, I couldn't manage my diabetes. It didn't seem like I was taking more than 50 units of insulin every day. I was giving myself a shot 4 times a day, and still couldn't seem to get it down. My numbers would be up to 200, 300s.
Yep.
I never had any low hundreds back in those days, which now I'm proud to say I'm down around. I usually don't get above 120 so far.
Correct.
Which has been
a lot better.
A whole lot better. I had a lot of stomach issues, burning. Never could get rid of the heartburn's what I thought it was. I've been taking Prevacid for years, a daily dose of Prevacid, which I now know is bad for other things. But it was causing a lot of issues with my digestion, my intestinal problems and things like that. I stayed tired all the time. My feet felt like they were going numb. I didn't have a whole lot of feeling in my toes anymore. I get these real bad cramps where I would just have to stiffen my feet and leg until it went away, kind of a thing. My hands would feel like dead, especially in the mornings when I would get up, like maybe 2 or 3 fingers on each side.
So what you were having really was, because of the diabetes, you were having what's called peripheral neuropathy in both your hands and your feet. And you had some, your toenails weren't right there either, because it had been like that for a while. So
I even had the red rashy ring around my toes.
Right, I forgot about that.
Going up and down each sides of my toes.
That had been there for a long time that you could not get rid of, and you were using a cream on there that hadn't worked either.
Right, I even went to the podiatrist and got cream, and it still didn't work, and they wanted to itch.
So part of what we did with your protocol was not just about getting the blood sugar under control, but we did a peripheral neuropathy protocol with you as well for the problem that you were having in the hands and feet. So what's going on there?
Now it's all better. I can feel again. I don't have to hobble when I get up in the mornings. I haven't had cramps in more than 4 weeks. It's been
great.
No cramps. My fingers don't go dead anymore. This is really great. I can feel them again. It was so bad in the mornings I couldn't hold my hands up long enough to curl my hair to get ready for work. So now I can do that without having to sit down.
Good.
I can stand up now on one foot again. I had to sit down to put my hose on in the mornings. I was really tired, just no energy at all, and I was like, I'm only 55, am I gonna be like this? This is like for old people kind of thing.
Right.
I'm so tired. My hands, I couldn't put my necklace on anymore because my fingers didn't work right.
Right, you couldn't feel the pieces that you're working with.
Yeah.
And you can do that now.
I can do that now.
Great. So the peripheral neuropathy that you came in with is pretty much resolved at this point. The blood sugar we're still working on. Although you were taking a little over 50 units a day, you were giving yourself a shot 4 times a day, and now, of course, with the help of your doctor and with them monitoring you as well, you've been able to lower those doses. To some days, I look at your sheet when you come in, and you've only taken maybe 5 units or 10 units or.
Right.
I think the most I've seen is 20 occasionally, and usually there's a reason for that you know about.
Right, and that's a total for the whole day, because I was doing that at one time, 20 units each.
Correct. Yeah, and that was 50 units of Novolog and then 25 of the Levemir. So we're down to like a total of, 5 to 15.
I don't do the Levemir anymore, and I'm either 5 or 10 units at a time in the day now.
And it's keeping you pretty
regular. Up or not.
Great. And we also were taking some other medicines for a couple different things. Talk about that.
When I came in, I was on a whole, I still take the Plavix and the lisinopril, because I did have a heart attack a year and a half ago, I guess. But I was taking things like Lipitor for cholesterol. They had Tylenol, which it was something heart related as well with that, which I don't take any of that anymore. I'm down to, I don't even remember them all.
Yeah, a whole lot less. So the more
I feel like I don't take anything anymore compared to when I came in.
Definitely a lot different. So the moral of the story is, really at 55, you'd already had a heart attack.
Right, and I always thought it was just from eating meat, but it was from the sugar.
It was from the sugar, but we also, there were some infectious processes going on that created inflammation that increased your risk for cardiovascular disease. So part of what we were doing with you is to reduce the inflammation that we found in the body, and also to address some of those problems with infections that you had as well. So
being on the Plavix for my heartburn was killing all my good things, which was making my, I guess, infections and inflammations worse, unbeknownst to me.
Yeah.
I was just taking it.
Yeah. Well, isn't it amazing that you were taking that Prevacid all that time and still suffering horribly, and then as soon as you get things right and you adjust your diet accordingly and you start to eat more, what you're supposed to,
right, then
those things just go away. So really, I mean, that in and of itself has been huge for you, because you had a very big problem with the burning, even initially. So it took us a while to get that under control, but really what we found was that there was some things going on in the gut that shouldn't have been there, and also that there were foods that you couldn't eat that were a problem as well. And when we removed those things that were keeping the fire stoked in there, then we see all of these really great results. No more burning in the stomach, the peripheral neuropathy in your hands and feet resolved, the blood sugar very, very much better. We still have some work to do on that, and I think there's still some improvements that we can make. But it's been...
it's only been, 7 weeks?
It hasn't been that long, you're right. We still have another 2 months to work with you, and I think my goal for you, of course, is for you to be in the best health ever by the time we're done with you. So we'll check back in with you a little bit later, okay, and see what's going on then.
Looking forward to it.
Great. Thank you so much, Deb.